Blood smells like copper and old pennies. Fear smells different. Fear is cold sweat and adrenaline and the specific, acrid bite of a body betraying itself. By the time that night was over, I would be the only person inside Street Agatha Mercy Hospital who could tell the difference between the two without flinching. I preferred it when nobody knew that about me. It was 11 o'clock on a Wednesday. I was sitting behind the triage desk filling out patient transfer forms, the kind that exist in triplicate for no reason anyone has ever been able to explain to me. Full Moon Wednesday. I've been tracking it for months without meaning to. Old habit. Full moon nights, the ER runs hotter. More lacerations, more domestics, more people arriving with improbable objects embedded in improbable places. The nursing staff called it the lunar effect. I called it a standard operating tempo. I called it that because I had a reference point most of them didn't. The fluorescent lights hummed. That low, abrasive frequency that burrows behind your eyes around hour 8 of a 12-hour shift. I'd learned to tune it out years before I ever set foot in a hospital. In the forward operating bases, the generator ran 24 hours. Same pitch, different smell. Diesel instead of antiseptic. Voss. Dr. Reeves's voice carried that particular quality of a man who had never once doubted that his inconvenience was the most important event in any given room. Why is Base 6 only getting vitals every hour? Protocol is 30 minutes. I didn't look up from the form. Care plan documents hourly for a stable post-procedural patient, doctor. I wrote that care plan. I know. Then you know I expect it followed to the letter. I set my pen down. I looked at him then. Reeves was tall in the way that men who peaked in their college years are tall, carrying it like a credential. He had the kind of face that expected deference the way a toll booth expects exact change. I had spent 6 years taking orders from men who could back them up with something other than a medical degree and a bad personality. I'll check on him in 15, I said. Flat, deliberate. Reeves held my gaze for a moment, decided he'd won something, and walked away. His shoes made that particular aggressive, squeaking noise on the linoleum that I was fairly certain he'd engineered on purpose. Lena appeared at my elbow like a nervous sparrow. She was 3 weeks into her clinical rotation, 22 years old, with the wide eyes of someone who had not yet learned that empathy and endurance are not the same thing. Is he always like that? She whispered. He's having a good night, I said. She laughed, uncertain if I was joking. I wasn't. I picked up my pen and went back to the form. The ER was cycling through its standard Wednesday rhythm. The drunk in Bay 2 had finally stopped singing. The elderly woman in Bay 4 with the hip fracture was sleeping, her face slack and peaceful in a way that made her look like someone's grandmother, which she was. A teenager in Bay 7 was on his 3rd attempt to convince Dr. Anand that his sprained wrist was actually broken, primarily because he wanted the good painkillers. Anand wasn't buying it. Neither was I, and I was 30 feet away. I was tired in the specific, bone-deep way that sleep doesn't fix. Not the tiredness of a long shift. The other kind. The residue kind. The kind that sits at the base of your skull like sediment and doesn't shift no matter how many hours you log horizontal. My left shoulder ached. It always ached in the cold. A piece of copper-jacketed reminder from Mountainside I had spent 3 years trying to forget the coordinates of. I rolled it once, felt the familiar grind of scar tissue against muscle, and stopped. Just a night shift nurse. I said it to myself the way you repeat a thing until it starts to feel true. You're just a night shift nurse. You take vitals. You manage pain scales. You are invisible, and that is exactly what you want to be. The ambulance bay doors were still. And then, at 11:19 p.m., they weren't. The first thing I noticed wasn't the men. It was the sound. Or rather, the absence of it. The drunk in Bay 2 stopped mid-sentence. The teenager in Bay 7 went quiet. Even the hum of the fluorescent lights seemed to recede, the way sound does when something louder is about to replace it. For men came through the ambulance bay entrance, not the sliding doors, the heavy manual doors that required a badge swipe and a deliberate push. They came through those, which meant at least one of them had a badge that shouldn't have been in his possession, or the badge reader had been bypassed, or someone on the inside had held it open. All 3 options were interesting. None of them were good. They were dressed like civilians. Dark jackets, dark pants, the generic urban camouflage of men who wanted to move through a city without generating description. But they moved wrong. Civilians bunch up. Civilians drift. These four moved in a loose diamond formation, two on the flanks slightly behind, one at the rear scanning, one at the point. Somebody had taught them that. Or they taught themselves through the kind of field work that doesn't appear on a resume. The man at the point was carrying someone. A fifth man, limp, draped across his shoulders in a modified fireman's carry. The carried man's shirt was dark with blood, and the blood was still wet, which told me it was recent, which told me he was still bleeding, which told me wherever they'd come from, they'd come fast. I set my pen down slowly. Don't react. Assess. These are the first two rules. Everything else comes after. The point man dumped the bleeding man onto the nearest empty gurney with the efficiency of someone who had done this before and wasn't interested in doing it gently. The bleeding man didn't make a sound, which was worse than if he had. Unconscious or close enough that it didn't matter. "We need a doctor," the point man said. His voice was controlled, not panicked. That was the second wrong thing. Civilians panic when someone is bleeding. This man sounded like he was placing a takeout order. Now, Dr. Reeves materialized from the hallway, drawn by the commotion with the irritated expression of a man whose important work had been interrupted. He looked at the bleeding man on the gurney, then at the four men surrounding him, and something shifted in his face. Something I recognized. The moment when the brain registers a threat that the ego doesn't want to accept. "Sir, you can't just..." The man at the right flank opened his jacket. He didn't draw the weapon. He just made sure it was visible. A semi-automatic, dark finish, holstered at his hip, but accessible in the way that communicates everything that needs to be communicated without a single word. Reeves stopped talking. "Nobody leaves," the point man said, addressing the room without raising his voice. He didn't need to. The ER had gone absolutely still, that terrible pressurized silence that precedes one of two things: complete compliance or complete chaos. Phones go on the desk. All of them. You treat him. We wait. Nobody gets hurt. His accent was faint, but there. South American, probably Colombian, the particular cadence of someone who learned English as a functional tool rather than a primary language. I filed it. I filed everything. I hadn't moved from behind the triage desk. Lena was beside me, and I could hear her breathing go shallow and rapid, the first stages of hyperventilation. I put my hand on her forearm without looking at her. Firm pressure. Grounding. She steadied. "Slow," I said, barely a sound. "Just breathe slow." I watched the four men sort the room. They were good at it. The one at the rear positioned himself at the ambulance bay doors, cutting off that exit. The two on the flanks moved to cover the internal hallway entrances. The point man stayed with the bleeding man, pulling a phone from his jacket and making a call in rapid, quiet Spanish that I was able to follow well enough to understand that he was telling someone outside that they were in, the package was secured, and they needed 15 minutes. 15 minutes. That was the window they'd given themselves. The bleeding man on the gurney was the package. Or rather, the bleeding man's survival was the package, which meant he was important enough to storm a hospital for, which meant he was either a significant asset or a significant liability, and given the company he was keeping, I was going to guess the latter. Reeves hadn't moved. He was standing in the middle of the ER floor with his arms slightly raised in the instinctive surrender posture of a man who had never before been in a room where the social contract had been openly discarded. He looked at me over the heads of the men. His eyes said, "Do something." I looked back at him and let my face say, "You are the attending physician, so attend." He swallowed. He walked toward the gurney on legs that had forgotten how to be casual. "Let me see him," he said to the point man. The point man stepped aside exactly enough to allow access. Not more. Reeves pulled on gloves with shaking hands, reached for the bloody shirt, and peeled it back. I was watching from the desk, and I could see the wound from where I stood. Entry wound, left lateral abdomen, below the last rib. The exit wound, if there was one, I couldn't see yet. The bleeding had the dark, venous character of a liver hit, which meant two things simultaneously. It could be survived, and it could not be survived slowly. Reeves looked at the wound. Reeves looked at the wound for too long. I knew what that meant. "What's his blood pressure?" Reeves said, and his voice had a tremor in it that shouldn't have been there, the vibration of a man whose competence has just met its ceiling. Nobody answered because nobody had checked. Nobody had checked because the nursing staff was frozen in a loose cluster near the medication room, doing the collective math of a situation they had no training for. The point man's jaw tightened. He looked at Reeves. Fix him. I need. Reeves started, then stopped. I need a surgical team. I can't do this here. You do it here. I am an emergency physician, not, You do it here, the point man repeated, and this time the two words carried a weight that had nothing to do with volume. Reeves looked at the blood pooling on the gurney. He looked at his own shaking hands. And then, in the specific, silent way that a system fails, he stepped back. One step, away from the patient, away from the problem. I watched him do it. I had seen that before too. Not in hospitals, in a different kind of room. In the moment when the person who is supposed to be in charge realizes they have reached the absolute edge of what they can absorb, and they step back from the edge, and someone else has to decide what to do about the edge. I was so tired. My shoulder ached. I looked at the cracked face of my watch. 11:31 p.m. The man on the gurney's arm slid off the side and hung there, limp, and his color was the specific grayish yellow of a circulatory system that is losing the argument. I stood up. I came around from behind the triage desk. I walked past Reeves. I didn't look at him. I walked straight to the gurney, and I put 2 fingers on the patient's neck, and I found a pulse that was thready and fast and getting worse. The point man stepped into my path. He was close enough that I could smell cordite on his jacket. Recent gunfire. Not his, probably. I looked up at him without adjusting my posture. I'm the nurse, I said. Step back. He looked at me for a moment with the evaluating look of a man who assesses threats for a living. I let him look. I had been assessed by better. He stepped back. I reached across the patient and grabbed the blood pressure cuff from the hook on the side of the gurney. I wrapped it, pumped it, watched the gauge. 74/40. He was in hemorrhagic shock, already stage 3, sliding toward 4. I had maybe minutes of useful window left before the cascade became irreversible. I need 2 large-bore IVs, O-negative blood from the trauma cooler, and a fast ultrasound machine, I said. To no one and to everyone. To the frozen cluster of nurses near the medication room. Now, move. Nobody moved. I looked at Lena. She was terrified. She was 22 years old, and she was shaking, and her eyes were too wide. But she was still standing. That counted for something. Lena, I said. Her name, simple, direct, a rope thrown across a gap. 4 supplies. Trauma cooler. Go. She went. The point man watched her go and didn't stop her. Good. He wanted the man on the table to live. That meant he'd allow the mechanics of keeping him alive as long as nobody walked out a door. I pulled on gloves and started assessing the wound properly, my hands moving through the familiar choreography of trauma evaluation. Entry wound, left lateral abdomen, between the 10th and 11th ribs. The bullet had traveled at a downward angle, which meant the shooter had been above or the patient had been below, and given the location, that meant liver and possibly the right hepatic vein, which was the expensive one to hit. But I could feel the abdomen, rigid in the left upper quadrant. Spleen, possibly, or a combination. Lena came back a run with the 4-tray rattling. Good, I said. Right antecubital, 16 gauge. Do you know how? I've done it twice in practice. 3rd time. I moved to the left arm. Go. She went. Her hands were trembling, but her technique was adequate. She got flash on the first try, and I heard her exhale in something that wasn't quite relief, but was adjacent to it. I secured my own line on the left side, connected the tubing, opened the fluid wide, and reached for the ultrasound probe. The point man was watching me with an expression I couldn't entirely read. Not hostility, something closer to calculation. What is your name? He said. Voss, I said, without looking up from the ultrasound screen. Are you a doctor? No. A pause. Can you save him? I moved the probe across the patient's abdomen, watching the screen, watching the dark fluid pooling in Morrison's pouch, in the spinorenal space around the heart sac. A lot of free fluid. A lot. That depends on what you mean by save, I said. He didn't answer that. I set the probe down and looked at the patient's face for the first time as a face rather than a problem set. He was mid-40s, dark hair going silver at the temples, a scar along his left jawline, old, well-healed, the kind you get young and carry forever. His breathing was shallow but rhythmic. Not gone yet. And then the point man's phone buzzed. He looked at the screen, and something changed in him. A tightening around the jaw. A new kind of attention. He looked at me. "We have a complication," he said. The complication arrived through the front entrance at 11:44 p.m. Not the ambulance bay doors. The main lobby doors, the ones that face the street. The ones that any civilian could walk through at any hour because Street Agatha was a Level 2 trauma center, and Level 2 trauma centers do not lock their front doors. It was the kind of institutional vulnerability that nobody thinks about until somebody exploits it. 3 more men, different from the first 4. Same dark clothing, same deliberate movement, but these 3 carried themselves with a different quality of tension. The first group had arrived with a purpose. These 3 arrived with a problem. The point man crossed the ER floor in 6 steps and met them near the nurse's station. The conversation was rapid and low and in Spanish, and I caught enough of it to understand that the original extraction plan had changed, that the vehicle outside was compromised, that someone was watching the parking structure, and that 15 minutes had become an indefinite timeline. I kept working. Lena was holding pressure on the second 4 line, her face white but her hand steady. I had pushed the first unit of O-negative through the left arm line, and the patient's pressure had climbed to 88/52, which was not good, but was less catastrophically bad than 74/40. His color had improved marginally. Not saved. Stabilized, and stabilized is a temporary word. "Talk to me," I said quietly to the patient. His eyes opened. Slow, gluey, the particular unfocused quality of someone who has lost enough blood that the brain is rationing its resources. He looked at the ceiling, then at me. "Lupe," he said. "A name. A woman's name, probably, said with the specific softness of someone reaching for the most important thing they know. "She's not here," I said. "But you are. Stay with me." His eyes tracked to my face. Something in them sharpened slightly, not much, but enough. "You're not scared," he said. His English was accented, but precise. "Not right now," I said, which was true in the way that partial truths are true. "Why not?" I secured the second unit of blood into the line and opened the flow. "Because scared doesn't help you. Focus on breathing. In through the nose, out through the mouth. Let me do the rest." He breathed. He was trying. That was something. The point man came back. He positioned himself 2 feet from the gurney and looked at me with the recalibrated attention of someone who has just received bad news and is now reassessing every asset in the room. "How long does he need?" he said. "To survive the night? He needs a surgeon or in the next 2 hours. We cannot move him in 2 hours. Then bring the surgeon here." He looked at me steadily. "There is no surgeon here who will operate under these conditions." I glanced at Reeves, who had retreated to the far wall beside the medication room and was doing an admirable impression of a piece of furniture. He caught my eyes and looked away. "No," I agreed. "There isn't." The point man studied me. "But you would." It wasn't a question. I didn't answer it. The thing about trying to be invisible is that it only works until someone looks at you with the right eyes. Not everyone has those eyes. Most people see what they expect to see. A night shift nurse in worn scrubs behind a triage desk, filling out forms in triplicate. A placeholder. A function. Background detail. But some people look differently. Some people have been trained to inventory a room the way I have been trained to inventory a room, cataloging threat levels and assets and anomalies. And when those people look at you, the costume doesn't hold. The point man had those eyes. I had known it from the moment he walked through the ambulance bay doors. I had hoped it wouldn't matter. "What is your name?" I said. Not Voss this time. His name. He considered whether to answer. "Santos." "Santos." I said it back to him the way you repeat a name to commit it to memory. "The man on this table." "Who is he to you?" A pause that told me more than the answer would. "My brother." I looked at the man on the gurney. The silver at his temples. The old scar on his jaw. The way Santos had carried him across a hospital floor with the brutal, desperate efficiency of someone who has already calculated what the loss would cost him and found the number unacceptable. I understood that math. I had done it myself, in a different currency, in a different country, in a lifetime that I had folded up and put away in a box that I did not open. His spleen is lacerated, I said. His liver may be clipped at the right lobe. He has significant internal hemorrhage. Without surgical intervention, he will continue to bleed internally, and at some point in the next hour to 2 hours, he will bleed past the threshold that blood transfusion can compensate for, and he will die on this table. Santos absorbed this without expression. Tell me what you need. I need a surgical suite. We have or on the 3rd floor, Lena said from beside me. Her voice came out small but clear, and I looked at her with something that might have been surprise if I still had the capacity for it. She swallowed. It's a minor procedures, or not a full trauma suite, but it has a table, lights, and a basic instrument set. We use it for. I know what we use it for, I said. I looked at Santos. He looked at me. If I do this, I said, and I'm telling you this clearly so that we understand each other, there is a significant chance he does not survive the procedure. I am not a surgeon. I have done battlefield surgical interventions, but a hospital is not a battlefield, and an abdomen is not a chest tube. Do you understand what I am telling you? You've done this before, Santos said. Not a question either. In circumstances I do not discuss. But you've done it. The fluorescent lights hummed. Somewhere in the back of the ER, a monitor beeped its steady, indifferent rhythm. The drunken Bay, too, had fallen asleep at some point during the siege, which I found privately extraordinary. Yes, I said. I've done it. Santos looked at his brother on the table. He looked at him for a long time. Then he looked back at me. Do it, he said. I turned to Lena. Her eyes were enormous, but she hadn't run, and she hadn't collapsed, and she was still holding that 4 line with both hands. 22 years old, 3 weeks into her rotation. You're my scrub, I said. You're going to do everything I tell you, exactly when I tell you, without asking why. Can you do that? A breath. A decision. Yes. Good. Let's move him. We moved fast. I pushed the gurney while Lena managed the 4 lines, and we went through the internal hallway, past the nursing station, toward the elevator bank. Santos walked beside me. One of his men followed at a distance. The others stayed in the ER. I noted the formation out of habit. 3rd floor. The suite was a converted room, the kind of minor procedure space that does cyst removals and INDs and the occasional orthopedic manipulation under anesthesia. It smelled like old sterilization fluid and floor wax. The overhead surgical light was a single articulating arm with 4 bulbs. The instrument tray had the standard minor procedures set: Kelly forceps, needle drivers, hemostats, a basic retractor, suture in 3 sizes, electrocautery, irrigation. Not ideal. Not impossible. I had worked with less. I thought of a riverbank in a province I never wanted to think about again, a headlamp, a field kit the size of a shoebox, and a 19-year-old kid named Corrigan who I needed to keep breathing until the medevac arrived. I kept him breathing. He came home. He sent me a Christmas card last year with a photo of his daughter. I scrubbed my hands at the sink, the scalding water, and the rough pumice soap. Beside me, Lena scrubbed in silence, her jaw set. If you're the kind of person who has ever wondered what it feels like to watch someone step off the edge of the person they were pretending to be and back into the person they actually are, I can tell you it doesn't feel like anything dramatic. It doesn't feel like removing a mask. It feels like remembering a language you tried to forget. The vocabulary comes back first, then the grammar. Then you stop translating and you're just speaking. I gloved up. Ketamine in the crash cart, I said to Lena. 50 milligrams, 4 push for sedation. He doesn't need to be deeply under. He needs to be still and pain managed. Can you draw that? Yes. Do it. She drew the ketamine. I pushed it. The man on the table, Santos's brother, whose name I still didn't know, went slack within 90 seconds, his breathing deepening into the rhythmic, dissociated pattern of ketamine sedation. His pressure held at 90/55. He was still with me. I opened the abdomen. I will not describe the specific mechanics of what happened in that or in clinical detail, because this is not that kind of story. What I will tell you is that it took 41 minutes. I will tell you that there were two separate bleeding sources, a splenic laceration that I managed with packing and direct pressure suture, and a small hepatic capsule tear that I controlled with electrocautery and topical hemostatic agent. I will tell you that Lena did not flinch once. I will tell you that Santos stood in the corner of the room the entire time with his arms crossed and his face absolutely still, and that he watched his brother breathe, and he watched me work, and he did not speak. At 12:49 a.m., I closed the abdomen with running suture, and I stepped back from the table. The man's pressure was 102/68. His heart rate was 94. His color was the pink of a system that has decided, at least for now, to keep fighting. I stripped off my gloves. My hands were steady. They were always steady during. It was after that they remembered to shake. I turned to Santos. He needs ICU-level monitoring for the next 24 hours, I said. He needs a real surgeon to evaluate my work in the morning. He needs broad-spectrum antibiotics and close hemorrhage watch. I paused. But he's alive. Santos looked at his brother for a long moment. He looked at the slow, even rise and fall of his chest. Then he looked at me, and something in his face shifted, that particular tectonic movement of a man who has been holding something very heavy and has been told he can set it down. He said nothing for a while. Then, ghost actual. The two words hit me like a physical thing. I went very still. I don't know what that means, I said. My voice was level. Years of training. Yes, you do, Santos said quietly. He reached into his jacket and produced a phone. He turned the screen toward me. It was a photograph. A blurry, low-resolution image, the kind pulled from a surveillance camera or a field report. It showed a woman in tactical gear, face partially obscured by a balaclava, crouched over a wounded man in a dusty courtyard, working with the focused economy of someone who had done this 100 times. The woman's left shoulder was visible where her sleeve had been torn. A small tattoo. A skull. I didn't look at my shoulder. I didn't need to. 3 years ago, Santos said, in Sinaloa, you were with a joint task force that hit one of our distribution points. You killed 4 of my men. He paused. But you also pulled one of my cousins out of the wreckage of that building when the roof came down. You stabilized him. You left him outside the perimeter where your people wouldn't find him. You made sure he was found by ours. I remembered. I remember the building. I remember the smell of concrete dust and cordite. I remember a man who was breathing when he shouldn't have been, whose uniform told me he was the enemy, whose face told me he was 23 years old. I didn't leave him to die. I never left anyone to die. I don't know what photograph you're looking at, I said. Santos lowered the phone. He looked at me with those inventory eyes. Then, very slowly, he nodded once. Of course, he said. Understand. A long silence. The surgical lights hummed above his brother's still form. My people will be gone in 20 minutes, Santos said. We will take him with us. He can't be moved. We have a physician waiting. He will receive appropriate care. Santos looked at me steadily. You have my word. I wanted to tell him what his word was worth. I wanted to tell him a lot of things. I looked at the man on the table instead. Alive. Breathing. The specific, improbable miracle of a body that had decided not to quit. Antibiotics, I said. Augmentin, 1 gram before you move him. Lena was already moving. Santos watched her go. Then he looked back at me. You could have let him die. It would have been easier. Easier isn't the same as right, I said. He considered that. No, he said. It isn't. They were gone by 1:17 a.m. Quietly, efficiently the way they had come. The ER staff emerged slowly from the places they had pressed themselves into, blinking in the fluorescent light, like people stepping out of the theater after a very long film, uncertain whether what they'd experienced was real. Reeves approached me in the hallway outside the 3rd floor, or he looked at the blood on my scrubs. He looked at my face. He opened his mouth. Don't, I said. He closed it. I walked to the elevator. I rode it down alone. I walked back through the ER, past the nurse's station, past Bay 2, where the drunk was still sleeping, past the triage desk where my patient transfer forms were still sitting in their incomplete triplicate, and I pushed through the door to the sluice room. The bleach smell hit me like a wall. I walked to the deep steel sink, and I turned the faucet on full blast, and I shoved my hands under the water. The blood went from dark to pale pink to nothing. The water kept running. I kept my hands under it long after they were clean, because the water was scalding and the scalding was real, and real was what I needed. My left shoulder ached. The skull tattoo on it was just a tattoo. It was just a thing a 26-year-old had put on her skin in a moment of absolute certainty that she would always know who she was. She hadn't been entirely right about that, but she hadn't been entirely wrong either. Lena pushed the door open. She stood in the doorway, looking at me with those wide, 22-year-old eyes, and for a moment neither of us said anything. Then she said, "The police are here, and someone from a hospital administration, and Dr. Reeves is telling them." "I know what Dr. Reeves is telling them," I said. "What do we do?" I turned off the faucet. I dried my hands on the paper towels, the rough, institutional ones that scratch the skin. I looked at my cracked watch. 1:31 a.m. I turned around and faced her. "We go out there," I said, "and we tell them exactly what happened. All of it." I thought about Santos. I thought about the photograph on his phone. I thought about a dusty courtyard and a 23-year-old with dust in his eyelashes and a pulse I had refused to let go. "Most of it," I said. Lena almost smiled. It was a shaky, exhausted, 2 a.m. kind of smile. But it was real. I smoothed the front of my ruined scrubs. I ran a hand through my hair. I pushed the sluice room door open with my elbow and walked back out into the emergency department. The fluorescent lights hummed their low, abrasive frequency. I had stopped hearing it years ago. If Mara's story of invisible courage and unbreakable instinct kept you holding your breath, share this with someone who needs to be reminded that the most dangerous person in any room isn't always the one carrying a weapon. Subscribe for more stories about the people who stand between chaos and the rest of us, the ones nobody sees coming. And drop a comment. What would you have done in Mara's place?